Did you know that failing the PSI Ireland exam just once can set back thousands of euros, months of delays? The biggest mistake overseas pharmacist is studying generic clinical knowledge instead of the actual 2026 blueprint. Don't do that. In this video, we are breaking down the official syllabus into a complete one-stop roadmap so you can pass on your first attempt. First, how will you actually be tested? The PSI Equivalence Exam is not about memorizing a textbook. It's a practical two-part assessment run by the RCSI in Dublin. Part 1 is the written MCQ round. It is split into two halves. Part A, which is a high-stake pharmacy math exam, and Part B, which tests your day-to-day pharmacy practice knowledge. You must pass both independently. Part 2 is the OSCE. Think of this as a live action round. You will interact with patients to prove you have the communication skills, clinical judgment needed for an Irish pharmacy. Pillar number 1, Irish law and ethics, the make and break zone. Let's start with the section that trips up most overseas pharmacists. Irish law. Generic pharmacy regulation would not cut it here. You need to know the specific rules governing Irish practice inside out. Focus your study on the Pharmacy Act 2007 and the official PSI Code of Conduct, the Misuse of Drug Act, meaning you need to master the controlled drug scheduling and safe custody rules. Pillar number 2, clinical pharmacy and OSCE workflow. Next up is clinical therapeutics. For this, British National Formulary, the BNF, is going to be your absolute best friend. The exam expects you to handle real-world patient scenarios like a pro. Make sure you can comfortably manage major chronic conditions, especially cardiovascular health, respiratory care and diabetes. Over-the-counter minor ailments, you need to know when to treat the patient at the counter and exactly when to refer to a GP. Spotting drug interaction and adjusting dose for special groups like pregnant patients or for those with renal issues. Pillar number 3, core sciences and precise calculations. Finally, you need to connect your scientific roots with absolute mathematical precision. You will be tested on biopharmaceuticals, formulation types and how drugs behave in the body. Pharmaceutical calculations, we are taking about child weight based dosing, complex dilutions, infusion rates. One tiny math error can fail a paper. Speed and accuracy are everything here. We understand preparing for the PSI Ireland alone can be challenging and time consuming, and elite expertise has the right mechanism to equip you with actionable strategies. Mastering this entire blueprint takes about 12 to 16 months of structured, consistent study. Focus heavily on the Irish legislation, practice your clinical counselling and run timely math mocks. To know more about how you can get started, just comment PSI. We will guide you further.